Hi, my name is Terry Dorland with Rise Local TV with another expert interview. And today I have Dr. Michael Weitz of the Ortho-K Center, who's an optometrist at the Ortho-K Center, in Bethesda, Maryland with us. Dr. Weitz, how are you?
I'm very fine, Terry. Thank you for inviting me.
It's great to have you here.
Great.
Okay, Dr. Weitz, so help us out here. You know, if someone is moving to a new city, maybe they're not happy with their current optometrist, what should people actually be looking for from an expert standpoint? I mean, help us sift through the noise. You've got 10 results on the first page of Google alone. Everyone's got a website touting how great they are. What should people actually be looking for?
Well, of course, the tried and true way is to ask friends, neighbors, relatives who live in that area who they see and whether they're happy with them. That being said, the best second way is to look for the reputation of the optometrist by looking at websites like Yelp reviews and Google reviews. And you want to specifically look for things like their experience. How many years in practice have they put in? You want to look at the quality of the service, which is oftentimes reflected in the technology available in the office, because you want an optometrist who's at the cutting edge of their profession. And some of these things that people don't know about are a scanning laser ophthalmoscope. This is an ophthalmoscope which lets us look inside the eye and to view the retina without the need for drops. And we can see about 200 degrees of the retina versus 30 degrees without dilation. There's also an instrument called the OCT, which allows us to see the different levels of the retina on a cellular level. So we can pick up things like a detachment or a pocket of fluid that may be lodged underneath one of the layers of the retina. One should also have at their disposal a field of vision instrument. Now, this field of vision instrument has no substitute, and oftentimes patients are not given a vision field examination. Last week I had a patient come in, and we have a little sign-up sheet, and she refrained from signing the information sheets stating that she wanted a field. But we talked her into it, and sure enough, it came out as like a problem. She has actually glaucoma, which would not have been picked up in any other way. We also would recommend that an office has topography. Topography is something that checks the three-dimensional aspect of the cornea. And also you want an office that is large enough to have an array of trial contact lenses at their disposal. And this allows us to fit very difficult patients, because then we have different types of lenses to try on a patient. You also may want to find out whether that office has subspecialties. Some practices have vision therapy, checking the binocularity of a patient and treating problems with binocular vision. Also, some offices are a little bit more equipped at handling things like eye disease. And some patients need a more rigorous evaluation to check their contact lens fit, because they sometimes have difficulties, and if we don't have the proper lenses for the patient, we can't solve the problem. So those are some of the things to look for when you're finding a new optometrist.
All that really makes a lot of sense. You know, look for the technology of the office. I'm sure things have changed over the last 5-10 years, and you can do things now that you couldn't in the very recent past. Look for the optometrist's reputation, as well as the old tried and true method of asking friends and family. And I know you have a really special office. I know you do some great things over at the Ortho-K Center. Talk a little bit about the patient experience if they were to come in and see you.
Yes, well, orthokeratology, unfortunately, is not well known, but it's an amazing technology. Orthokeratology allows us to or mold the cornea so that we get the same results as in refractive surgery without the need for surgery. What one does is sleep in a pair of corneal molds, and overnight the cornea changes shape, so that in the morning when you wake up, you take the lenses out and see perfectly well. And therefore, things like doing a lot of computer work, which will oftentimes be a problem if you're wearing a soft contact lens, because a soft contact lens can dehydrate during the day especially if you're doing a lot of reading or a lot of computer. This does not have that issue. You can get good vision without spectacles or contact lenses for most of the day, and some patients only need to wear the lenses 4 or 5 nights a week. It's not a surgical procedure. It's reversible. It's modifiable. It doesn't hurt. Children can safely wear ortho-K lenses, and recent research has shown that we can actually slow the progression of nearsightedness by up to 65% in children. And when there is a very small change in prescription, we can modify the mold so that a patient can continue to see clearly. Of course, if you have laser surgery, that would be a problem, because then you'd have to have surgery, and multiple surgeries at that in many cases, which of course is not advisable. The other advantage of orthokeratology is that the procedure is reversible, and there is no postoperative pain, and it's significantly less expensive than LASIK. So those are some of the advantages for orthokeratology, Terry.
Wow, talk about advancements in the field. I had no idea that existed, and I'm sure a lot of people who are watching this video don't even know that exists either. So Dr. Weitz, I know you've got a really special offer for people who happen to be watching this video to come in and actually experience the difference at the Ortho-K Center. What do you have for our viewers here today?
Well, for your viewers, we're offering a free consultation, which is normally a $75 fee, and the free consultation talks about orthokeratology specifically, to see if you're a good candidate and to answer any questions you may have. And so that is available for your viewers. And the best way to receive that is to email us at orthokcenter@aol.com and let us know that you've seen the presentation, and we'll send you a coupon for that consultation.
Wow, that's a fantastic offer. And what's another way for people to get a hold of you, Dr. Weitz, to get a hold of the office?
Well, we have a website, drorthok.com. That's DOCTORORTHOK.com, no hyphens. You can always email me at the email address we indicated. The information phone number is on the bottom of your website, but it's 301-717-7330, and our appointment phone number is 301-656-0775.
Dr. Weitz, thank you so much for being here today. You've provided some great information for people.
Thank you, Terry. Thanks for inviting me.
All right, great to have you. All right, everyone, thanks for being here with another one of our expert live interviews. Terry Dorland with Rise Local TV. We look forward to seeing you in the future.